next is the general behavior and observations. Okay, the third one is will see general behavior and observation of the baby. In that, the first one is comes the color. So you have to see the color of the baby. I'm not talking about the skin color, whether it is white or black, gray color, wheatish, not that one. You have to see the skin color for the like circulation, in order to find out the circulation. So what you will find out, whether it is a pinkish or gray or bluish. Okay, this you have to find out. Means if it is a pink, means the baby's circulation is normal, so baby look will be pinkish in color. If it is in the grayish or bluish discoloration, that you have to see the extremities. If it is like central extremities or peripheral extremities, that will be diagnosed as a cyanosis. If the baby is having any problem in the circulation, then the baby will find this thing. So that's why when the baby will born, you have to cover the baby fully. Okay, so you need not to expose more to the should not expose, means should not keep the baby naked. Okay, that's why. So if you'll keep the prolonged time naked also, the baby will extremities will be in bluish color. So you have to cover the baby thoroughly, especially head, because head is the only larger area in order to lose this temperature only or skin circulation. Okay, so you have to cover the baby thoroughly. So that you have to find out in the color. So next you have to see the skin for lanugo. Lanugo means it is like a fine and downy hair means hair will be present, okay, on the baby skin. Okay, it will be like fine hair like structure, and it will be like down like. Okay, it covers mainly especially shoulder, back and upper arms. And this will mostly we will see in the preterm babies, not in the term babies, and the postterm babies will be there. So that you have to find out whether it is present or not. Next is the vernix seosa. So what is vernix seosa means? It is a white, creamy, cheesy like substance, okay, which will cover whole body of the baby. Okay, it will be serves as a lubricant, and it is mostly we'll see in the postterm babies. Okay, because in the postterm what will happen means there will be decrease in the amniotic fluid. Because of that only this white creamy cheese substance will be present all over the baby. So that you have to see. With this also we will find out that the baby is a preterm or the postterm. Okay, so this is present or not, you have to see. Next is the jaundice. Okay, some babies, if there is any pathological issue, okay, I'm not talking about the physiological. If the pathological issue means if there is any related to liver, okay, that time the baby will show the skin in yellowish in color. So whether it is present or not at the birth time, you have to see. So after delivery, 3 to 4 days after delivery, we will see the physiological jaundice. Okay, that is related to the breakdown of the RBCs. Okay, that is the another thing. So we have to find out this. Then next you have to see the cyanosis. Okay, cyanosis means whether there is any bluish discoloration is there in the extremities after covering the baby, also fully covered. Okay, that you have to find out. If it is there, means there will be problem in the vascular or circulation, heart related issues will be there. Next is you have to see any presence of rashes on the skin. Okay, like milia, erythema toxicum, forceps marks, skin turgor. Okay, so milia means like a small pimples like structure it will be. Okay, mostly it will present on the forehead of the baby. Okay, so the chest. That erythema toxicum means pimples like structure only, but it is in a red in color. Okay, reddish color will be there. So this is present, or forceps marks will be there, like on the face or the skin. That forceps, which whatever the forceps instruments you will use during delivery time, that marks will be present on the head or cheeks. Okay, is it present or not, that you have to see. Then skin turgidity means folds. Okay, most folds, excess folds, skin folds will be seen in the thumb and finger area, whether it is present or not. This all you have to see. And Mongolian spot, next is the Mongolian spots means like it will be like a greenish color marks will be present on the area of the buttocks region. Okay, it mostly found in the buttocks region, upper. Okay, whether it is present or not, you have to see. Or any birthmarks like moles, okay, black in color. If there is any presence of moles are there or not, that you have to find out in the like present or not. That is comes under the birthmarks. Next we will see the head. Okay, in the head what all we will find out? First is the anterior fontanelle, which is the present like a opening space, which is look like a size in the diagonal shape in between the frontal and the parietal sutures. Okay, they soft in structure, soft in nature, pulsation will be palpable. Okay, so whether it is present or not, you have to see, or any deviation in the size and the shape. And posterior fontanelle means it is back of the head, it is in the triangular in shape. Okay, and this opening will be in between the lambdoid sutures, occipital, so as occipital bone and sagittal sutures. Okay, occipital, lambdoid and sagittal sutures. Okay, so where these are present or not, or any deviation in the size and the shape, that you have to see. And next you have to see any presence of cephalohematoma or caput succedanum. So what do you mean by caput succedanum and cephalohematoma? Means the name itself, it is telling hematoma means there will be bleeding in the occupied, means in the spaces of the cephalo, means in the head. Okay, that is due to the any like forceps delivery or prolonged station of the second stage or the second stage or first stage of the delivery, because the head will be stay prolonged time in the pelvis, no, because of that it will form. And caput succedanum means the position of the head will be the different. Okay, because of the stages of the labor, that time this is staying in the head which passes through the birth canal, that time it will form, and it will be subsided within the weeks or the weeks, 6 to 8 weeks. Okay, and bleeding will be the present between the skull and the peristoeum of the newborn baby. Okay, so whether it is present or you have to see. And the forceps marks also you have to find out whether it is present or not. Okay, next you have to see the face. Okay, in the face what all you will see? Eyes, what all you have, what you have to examine, whether there is any presence of redness. Okay, purulent discharges are there, or subconjunctival hemorrhage is present or not, ophthalmia neonatorum is present. Because if the mother is having any infection, okay, any infection in the vagina, okay, there is a maybe chance of contacting with the eyes of the baby during birth canal. Okay, because of that there will be can be seen these signs and symptoms. So whether it is present or not, you have to find out. Then next is the mouth and throat. You have to see any presence of cleft lip, cleft palate, or tongue tie, means movement of the length of the tongue you have to find out. Okay, then in the nose is there, you have to see the about the any examine the this nasal openings. Okay, any discharges are there, or any polyps you have to find out. Any deviated nasal septum, okay, is the present or not. Okay, this all you have to find out in the nose. Then ear you have to see that the level of the external ears. Okay, by marking the this one line, imaginary line from the this one external ear level, pinna, from the pinna to the outer canthus of the eye. Okay, whether it is a normal or abnormal in shape, size, position of the ear you have to see. Because in the Down syndrome the ears will be the below the imaginary line drawn between the pinna form of the ear and the outer canthus of the ear. So that you have to find out if there is a instant recoil is there or not, you have to see. And when any ear deformities are present or not, that all you have to find out, and you have to write the remarks. So next is the same, cleft lip for cleft palate ear cartilage is present or not, you have to write. Then the next is the trunk. Okay, trunk means any absence of retractions. Okay, you have to see the trunk size and shape. Okay, and any retractions are present. If the baby is having a difficulty in breathing, then you will find out the retraction of the trunk. So if it is present, means the baby is having a difficulty in breathing. Okay, that all you can find out by seeing observation of the trunk. In the trunk also, what all you will see? Breast nodules. Okay, if there is any presence of breast engorgement, thin watery fluids are excreting through the nipple. Okay, that is which is milk, we'll call with, it is normal, and it because of the hormonal imbalance in the mother during the womb period. Okay, but it is subsides within weeks. Okay, whether it is present or not, that you have to see. Okay, then abdomen. In the abdomen, what you will find like a bowel sounds. Sounds will be you will able to find out within the hours after the birth. So that you have to check it out. And edges of the liver means when you are palpating the abdomen, whether you are finding any edges of the liver or spleen, which is seen in the 1 to 2 centimeter below the right costal region area. So whether it is there or not, you have to find out. If whether it is a soft by touching. Okay, that all you have to find out during abdominal examination. Then umbilical cord. Okay, umbilical cord, what you will see? There is a presence of 2 arteries and veins. Okay, that you have to find out. Okay, normally you will have the baby will have the 2 arteries and 1 vein, and whether it is a bluish or white in means the normal color of the umbilical cord, it is bluish white in color, and it will be moist in nature, and it will shed off within the 6 to 10 days. That you have to find out whether there is any abnormal or not. Okay, then hands for that you have to observe for the syndactyly and polydactyly. Okay, means most actually normally we will have a 5 fingers. Okay, 5 fingers on each hand, means 10 fingers and 10 toes. But in rare cases you will find the extra finger or extra toe also will be present. So that is there or not, you have to find out. And creases. Okay, normally we will have a 3 creases lines on the palm. Okay, but in the Down syndrome or in congenital abnormalities, it will be absent. So that creases are present or not, and the hands, that you have to find out. Okay, and legs and the feet, sole, creases means that folds of the skin. Okay, whether it is present or not, you have to see. Like in the postterm babies and preterm babies, you will find out so many folds will be there on the hands and the this toes. Okay, in the term babies we won't find out whether it is present or not, that you have to find out. And in the genitalia area, that in the male babies you have to find out in the scrotum is present or not, and descendants of the testes by palpating the scrotum. Okay, that also you have to find out. Okay, and in the female, whether there is a formation like labia majora, labia minora foldings are present or not, that have to see. In some cases you will find the pseudo menstruation, that is some this one abnormal hormonal changes in the mother, but it will be subside. Okay, within weeks, no need to have to worry. So this you have to see. And muscle tones. Muscle tone means retractions you have to see, like whether it is a flaccid tone of muscles or not, that you have to find out in the muscles. Okay, now we will find out the neurological function of the baby by doing the reflexes. Okay, reflex, first is the blinking. Okay, blinking of the eyes spontaneously to the like tapping on the forehead, or showing the light, torture, sudden appearance of the bright light on the eyes, if there is a blinking present or not, that you have to find out. Okay, then Babinski reflex. Okay, in this what we will do means we will stimulation will be applied to the edge of the sole of the foot. Okay, so we will apply some stimulation. So how the baby will respond? It respond by the plantar flexion. Okay, there will be, we can see the plantar flexion by either flexion or extension of the toes. Okay, so that will be like that reflex is called the Babinski reflex. And then Babinski reflex will be disappears in the 12 months of age of the baby. Okay, till that it will be there. Then next we will see the Moro reflex that will disappears in the month of 6 months. Okay, it is a sudden action. Okay, sudden action when it takes place on the baby will show the that Moro reflex. So how means the examiner will be hold the baby on the in the both the hands by grasping or hold supporting the head and the this buttocks with the hands. Then sudden drop of the head when we'll show the sudden drop of the head from the hand of the examiner. So the baby will show the movements like extension and abduction of the upper extremities, and followed by the anterior flexion of the upper extremities, and audible cry will be there. So that reflexes is called the Moro reflex. And grasping reflex means if you give anything to the hand of the baby will hold it tightly. Okay, so that reflex is called the grasping reflex. And rooting reflex means if you tap the cheek of the baby, okay, with the little finger of your hand, then the baby will turns the head to that stimuli, thinking of the nipple of the mother. Okay, that is called the rooting reflex. Okay, then stepping reflex means when you will hold the baby in the supine position. Okay, and you will touch the this steps this legs of the baby to the flat surface. So that time the baby will try to keep on the surface, touching the surface. So that is reflex is called the stepping reflex. Then sucking reflex means if you will keep the clean finger in the mouth of the baby will start sucking. Okay, sucking of the finger. That will call the sucking reflex. So next is the tonic neck reflex. So how it will the baby will show means by rotating the infant's head from midline to one side of the baby. Then the baby will respond by extending the arm on the side to which the head was turned and flexing the opposite arm, and the lower extremities also responded similarly. Okay, that type of reflexes is called the tonic neck reflex. It is present or not, that you have to see. Okay, gagging reflex means swallowing reflex. Okay, if you will keep anything in the mouth, the baby will swallow. That reflex is called the gagging reflex. And laughing and the sneezing means by keeping something, if you'll do or if you'll speak, the baby will show the some smiling and laughing. Okay, that is called laughing reflexes. Or sneezing reflexes means if you'll keep anything like a cotton, okay, making the tip point straight, and if you'll give the some stimulation to the edges of the nasals of the nose, the baby will have the sneezing. So that is the reflex is called sneezing reflex. And the next is the cry. Okay, whether the baby's cry is audible or not. Okay, that you have to see how the baby is crying. Okay, it is a like light or lethargic crying is there. That all you have to find out in the cry. Then Apgar scoring at birth. Okay, then you see means heart rate you will see. Okay, breathing pattern, reflexes. Okay, reflexes. Then muscle tone. Okay, color of the skin. Okay, so heart rate, if it is absent means we will mark it as 0. If it is less than 100, we will mark it as 1. If it is more than 100, we will mark it as 2. And breathing, if it is absent, 0. Okay, if it is irregular or weak, we will mark it as 1. Okay, then strong, cry, strong means more regular, and cry is present means we will mark it as 2. Then reflexes, absent means 0. Then grimace like weak cry to stimulation. When we'll stimulate the baby, there will be weak cry will be there. So that time we will give the grimace 1 mark. And if you cry strongly pulls away the stimulation. Whatever the stimulation we will give, baby actively pulls to himself, that time we will give the 2. Then muscle tone. Muscle tone totally absent means 0, and only limited movements of the extremities will be there means we will give 1, and total spontaneous extremities we will there means we will give 2. Then color of the skin, I already told, if it is a pale or bluish discoloration, 0. Extremities are blue and central it is pink means we will give 1, and total pink means we will give the 2. So like this we will mark the Apgar score. Okay, and it will check it in the 1 minute and to 5 minutes. So what the Apgar score is carried the baby in the 1 minute and 5 minutes, that you have to mark here. First feed given or not. First feed when you will give, if it is a normal delivery, you have to advise the mother to give the feeding means less than 30 minutes means after delivery you can feed the baby. If it is a cesarean section, you have to ask the mother to feed the baby within 1 to 2 hours. Okay, so when the first feed is given, that you have to mark it here. And type of feed given means mostly we will give here breastfeeding only, but in some circumstances only, if the mother is having any issues, okay, like if the mother is developed any eclampsia or any bleeding, postmortem hemorrhage will be there, in that conditions only the mother is not able to give the breastfeeding. Okay, in other than that conditions the mother can give the breastfeed. So what type of feed has given, that also you have to mark, whether it is a breastfeed or a topical milk has given or powder milk is given, that you have to mark. Then total requirement of fluids and calories. So how much calories are needed for the mother, that you have to write here. Okay, by checking, okay, nutritional status. Then urine passed or not, that you have to mark. If it is a normal openings are there, the baby will be passed, okay, within means hours or days. How the long time is taking means there is a problem in the baby, that you have to find. So here you have to write down the time, and how many times the baby was passed. One thing I forgot to mention here, in the genital area, that also in the you can find out whether there is anal opening is there or not, that also you have to find out in the leg, feet, okay, muscle tone, whichever you are finding here, there you can see the anal opening. And back also you can check it out when you are checking or observing the trunk area also. Okay, back like vertebral column, you have to see any presence of spina bifida, meningocele is present or not, that all you have to find out when you are checking the trunk and the genitalia legs. Okay, here only you have to find out that things also. And the next is there what all the health education you can give to the mother. So it includes mostly breastfeeding, okay, care of the skin, this is for babies, care of eyes and the umbilicals. So breastfeeding, so what can you will educate here for the breastfeeding? Okay, you can educate the mother about the position, okay, how to position the baby while breastfeeding. Okay, like natching means how to cover, that means when the baby is do the breastfeeding, that whole nipple has to be go inside the mouth. Okay, that position you can educate the mother, how frequently she can give, okay, that you can tell. Okay, care of the breast, how she can take the care of the breast, you can tell that also. Okay, then what all the food she has to take in order to increase the breastfeeding. Okay, and you have to educate means some. So in the care of eyes, what we will tell, we will ask the mother to wipe with clean and washed and cotton cloth only. Should not keep whatever the cloth she is getting in the hands. Okay, then you have to cover the hands of the baby, because there is a chance of hurting herself or himself. Okay, that you can tell. Umbilical, okay, umbilical also you can take care of the umbilical by wiping with the betadine or with the clean distilled water. Okay, and it will wipe off, it will get off within 6 to 7 days. Okay, that umbilical care also you can keep here. Then here what in the reference, so whatever the we have discussed here. So in that, whichever the article you have referred, that article's names you have to write here. Okay. So that's about the assessment of a newborn baby. Okay. So if you have any doubts and if you want to clarify anything regarding about the assessment, I as usually tell, please pin or comment me in the comment section. I will clarify your doubts. Until then, take care, bye, and we will meet in the next video.